Hi, my name is Laila Abigail Hurtado Cañaveral, and today I'm presenting my case report titled Non-segmental vitiligo associated with chronic telogen effluvium and excoriations in a patient with thyroid disease. This clinical case was developed during my medical exchange in the Department of Dermatology at the Hospital Universitario Dr. José Eleuterio González en la Universidad Autónoma de Nuevo León. Introduction. So, vitiligo is an acquired pigment disorder characterized by the selective destruction of melanocytes, resulting in well-defined white patches on the skin. It affects approximately 0.5 to 2% of the global population. And it's frequently associated with autoimmune diseases, particularly autoimmune thyroid disorders. On the other hand, chronic telogen effluvium is a common cause of diffuse hair loss. It occurs when a large number of hair follicles prematurely enter the telogen or resting phase of the hair cycle. Although it can be triggered by stress, nutritional deficiency, endocrine disorders, or medications, it may also coexist with autoimmune conditions. Sorry, this case is interesting because it illustrates that the coexistence of non-segmental vitiligo, chronic telogen effluvium, and excoriations in a patient with hypothyroidism, emphasizing the importance of evaluating associated systemic diseases. The case presentation was a patient of 50 years old woman from Monterrey, Mexico, with a medical history of hypothyroidism, treated with levothyroxine 25 micrograms daily. At the time of the evaluation, her thyroid function tests were within normal limits. She presented with 1 month history of progressive enlarging depigment skin lesions. These lesions initially appear on the face and later involve both hands. She also reported progressive diffuse hair thinning but denied systemic symptoms or previous use of topical medications. On the dermatological examination, the patient had multiple well-defined achromic macules consistent with vitiligo. The facial lesions showed a bilateral but asymmetric distribution. Examination of the scalp revealed diffuse reduction of hair density compatible with chronic telogen effluvium. Additionally, localized depigment lesions were identified in the perineal region, and superficial excoriations were also observed. Based on the clinical findings, the patient was diagnosed with non-segmental vitiligo, chronic telogen effluvium, and excoriations. Management. The treatment included a comprehensive approach. For vitiligo, the patient received topical tacrolimus with photoprotection. For chronic telogen effluvium, she started on topical minoxidil 5% and vitamin C supplementation. She also received topical denosine cream for the inflammatory skin lesions. And a regular follow-up was scheduled to monitor clinical response. So, this case highlights the well-recognized association between non-segmental vitiligo and autoimmune thyroid disease. Although the patient hypothyroidism was adequately controlled, the coexistence of vitiligo supports the concept that autoimmune disease frequently overlap. In addition, chronic Telogen effluvium may be related to endocrine dysfunction or other systemic factors. Therefore, diffuse hair loss in patients with autoimmune disease should not be overlooked, as it might require additional evaluation and treatment. The presence of excoriations further emphasized the importance of performing a complete dermatological examination, since multiple skin conditions may coexist and influence both diagnosis and management. I'm happy to be in this exchange program. I'm having such a great time and learning in the hospital. The residents have been very kind to us. I've been able to learn a lot of things that I wasn't able to see in my country because of some limitations. But but here every day we can see a lot of patients with multiple skin conditions and hair condition and nails conditions that can help me to be a better doctor in my home country in Colombia. Thanks for listening to me, for taking the time, and I hope that this case report can show us the importance of doing a complete examination and treat the patient as a whole and not just little bits of pieces of each one of them. Thanks you very much.